Hello, my name is Lauren Turvey. I'm a highly specialised cardiac physiologist and I work at the Queen Elizabeth Hospital in Birmingham.
Hi, my name's Will Bradlow. I'm one of the cardiology consultants here in Birmingham.
So the BSc has recently updated the adult transthoracic guidelines for performing echoes in patients with hypertrophic cardiomyopathy. The last guidelines were released in 2015. So 6 years down the line, we have improved understanding of cardiac evaluation in hypertrophic cardiomyopathy. And we are able to highlight the importance of these various disease features. And that allows us to distinguish from various mimics of hypertrophic cardiomyopathy.
This guideline provides people undertaking scans in patients with hypertrophic cardiomyopathy a how-to guide for accurate assessment and reporting. And it covers a range of different topics, including accurate measurement of wall thickness, those grey cases where left ventricular hypertrophy could be due, for example, to hypertension or aortic stenosis. The language people reporting these echoes might use to help the clinical team understand the findings. We spent some time discussing the positioning of the echocardiogram within the diagnostic pathway. We talk about diseases that can mimic hypertrophic cardiomyopathy. We discuss how the pattern of left ventricular hypertrophy should be described, as this has a role in understanding whether or not your patient has a positive genotype or not. And then we go on after the diagnosis is established to talk about how echo can be used in risk stratification and in the assessment of disease complication before completing with a section on stress echocardiography and a view-by-view standard HOCM protocol.
It should be said that this document is very in-depth and highly comprehensive. We've covered a range of topics in the role of echocardiography within the cohort of hypertrophic cardiomyopathy. However, we do await developments in the field of strain to see whether this will play a greater role in the future.
When we put this guideline together, the committee hoped that it will translate into clinical practice nationally, so that patients who are either suspected of having HOCM or have the condition have a standardized comprehensive echocardiogram that is reported unambiguously wherever possible. And this will minimize the chances of over or under diagnosis and ensure that clinical pathways for these patients are as efficient as possible.
So in terms of comparing the new BSc guidelines with American and European practices, first of all, it should be said that there is a clear standardization in terms of quantifiable numbers that are important to the echocardiographer, which are the same throughout. For example, provocable LVAT obstruction gradients. Second of all, the BSc document has been as practical as possible. It was almost written in the viewpoint from the echocardiographer acquiring the images. It provides a how-to guide, so it lists the measurements and the views you need to acquire, how you go about doing this accurately, and also the importance and the rationale behind why you're doing those measurements. And lastly, it is consistent with other guidelines when it comes to key echo data, such as how we define LVAT obstruction.
So our view, reflecting on what we've written, is that there is not anything in the guideline that people will find terribly contentious, but I'm very happy to hear from people with feedback. feedback we've had has been really positive, and we've been really pleased with the response.
And last of all, we're really looking forward to hearing feedback from departments throughout the country on how they found implementing the new guidelines.